Hi, guys. Welcome back to your fifth and final lecture on the respiratory system. I know it's a lot, but hopefully you're enjoying some of the topics. I got a lot of good feedback about the David Blaine video. Interesting guy. Of course, when it comes to doing little experiments, hold your breath is probably one of the first scientific experiments you ever did, and it's pretty interesting one. Imagine holding your breath for 17 minutes. It's hard to imagine. Of course, that is a perfect segue into our next topic, which is how do you control respiration? Well, it's an autonomic response. So this is a reflex you have. When you fall asleep, you don't stop breathing, hopefully, and of course that it comes under the control of these new ataxic centers that you find in the medulla and the pons. Those are those hindbrain, or I'm sorry, those midbrain structures as we lead down in the spinal cord. They're very primitive functions, and they rely on the chemoreception of these receptors in the carotid artery. That's the one in your neck. You take your pulse in your neck. That's the carotid you're feeling there, and the aortic arch. Of course, the aorta and the carotid are both major arteries. The aorta is the biggest one that emerges from your heart. And so the pons and medulla are constantly getting information about chemoreception there. And one of the things we're looking at is blood pH. All right, so remember that we've talked about this quite a bit. CO2 and water in the blood combine to form carbonic acid. Carbonic acid dissociates into bicarbonate ion and hydrogen ions. And of course, we measure hydrogen ion concentration as pH. Increases in hydrogen ion concentrations cause a decrease in pH. A decrease in pH, remember that. Lots of hydrogen ions means low pH, and of course you don't want that. And so you can sort of manipulate blood pH levels by controlling respiration, all right? So you could hyperventilate, and well, I'll just ask you some questions about that. What happens when you hyperventilate? Why is this guy from the Big Bang breathing into a paper bag? Of course, another important gas measurement that's occurring is oxygen concentration. So having too much CO2 is a really bad thing in terms of manipulating blood pH, but not having oxygen is also critical. And so low oxygen levels will also cause an autonomic reflexive response to those changes in O2 levels. And of course, when you breathe, when you ventilate, one of the important things we're going to look at is these things called lung volumes. And probably the most important lung volume for us is the tidal volume. And the tidal volume is only half a liter. Hopefully you guys know what a liter is. I know you know what a 2-liter bottle of soda looks like, but a liter is about the size of, I don't know, if you buy half and half, it's not a full gallon. That's a liter. It's about 956 milliliters, but close to a liter. Half of that is what you're breathing in and out. Not much. Not much. Then you have these other volumes, the inspiratory reserve and the expiratory reserve. Inspiratory reserve, you can force your breathing in, and you can force your breathing out. And so those are what those reserve values, inspiration and expiration. And then finally, you have this concept of residual volume. Breathe out all the way. Guess what? Your lungs are not empty. You still get about 1.5 liters of air trapped in those alveoli. And so that leads us to these capacities. So the total lung capacity is about 6 liters. Okay, you could breathe in 3 liters, and you would have 3 liters to breathe out, but of course you'd never be able to get rid of that residual volume. And so we measure that. What you can move in and out is the vital capacity, right? So if you breathe in all the way and you breathe out all the way, that's your vital capacity, and you're still left with about 4.5 liters of air. I'm sorry, 1.5 liters of air, but that total vital capacity is about 4,500 ml, or 4.5. Huh. If you're a respiratory therapist, that's important. Here's a nice summary of that. And speaking of respiratory therapy, it's not a bad job. It's a 2-year degree, or at least it was a 2-year degree at a tech school. Pays not bad, and there's all kinds of upward mobility within medicine generally, and with that job as well. And I know that because my brother's a respiratory therapist. And if you're interested, let me know. can hook you up. Anyway, we look at these forced expiratory volumes, and we look at them in terms of 1 second. So if you're breathing out, I measure how much you can breathe out in 1 second, and I compare that with your forced vital capacity, how much you can breathe out in total, and I can identify diseases. And so they generally break down into two types: restrictive and obstructive. All right, so you're either not able to get it in, or you're not able to get it out. And there's all kinds of ways for you to cause damage to your lungs. For instance, the most common way is just to be invaded by our friends, the viruses. Okay, so we've been studying the COVID virus. The most common respiratory infection occurs through coronavirus. We call this a common cold. It's a rhinovirus. That is, it starts off in your oral nasal cavity, rhino, like a rhinoceros, and so the problem with these things is they can be minor, but they can often lead into secondary bacterial infections. Now, bacterial pneumonia is problematic. So anyway, there's these things get on your hands, and then you touch your face or you rub your eyes, and you got it. Viruses are really small, and they like to reproduce rapidly. And we've been talking about this. You've heard it everywhere. Wash your hands. Don't touch your face. Unfortunately, we've reached epidemic levels or pandemic levels with the COVID virus, and we've already got an endemic viral infection in our population. That's the influenza A and B virus. And when this whole thing started, people were talking about the average number of deaths for influenza A and B being like 80,000 a year. So, what's the big deal? Well, guess what? That happens over the course of the year. We've got 50 or 60,000 deaths in the last couple of months. And here's the bad news, guys. I hate to tell you, it comes in waves. So we're just looking at, looks like the plateauing of wave 1, which means there's a good likelihood that the wave 2 is going to occur in the fall of 2020, right when you guys are ready to go to college or start your senior year. And it's gonna occur at the same time influenza A and influenza B normally become active. So it could be a very interesting fall in terms of respiratory infections. It's depressing. What's really depressing is pneumonia. All right, so pneumonia is what everybody's being treated for. Pneumonia is simply a blanket term that speaks to the accumulation of fluid, effusion in your lungs. Remember that the mast cells release histamine, and that mediates the immune response, the histamine, the collection of fluid. Edema is a collection of fluid. Histamine incurs that. Remember that we have all this cytokine response, a cascade of different different immunoglobulins that are released in response to infections with all kinds of interesting outcomes. And these all can lead to pneumonia, right? So pneumonia is bad. You have this fluid accumulation. It inhibits the ability of these cells to exchange gases. So remember that we have the alveolar type 1 and type 2 cells. And so if I have a lot of fluid accumulating around these alveoli, that disallows the movement of CO2 and oxygen. Similarly, if the accumulation of fluid becomes so great, I can actually have sort of a mechanical suppression of the movement of the lungs, right? It just becomes harder and harder to keep those sacs open, and even to move, to pull gases down inside of there. So we have the common lobar pneumonia, and you can have double pneumonia if 2 lobes are infected, or triple pneumonia if 3 lobes are infected. Of course, sometimes that refers to the right and left lungs, but that's minutia. In Philadelphia, we had this terrible type of pneumonia called Legionnaire's disease that occurred at the Bellevue Stratford, I think in 1976 and 1977. But it was this wicked outbreak, and it killed a bunch of Legionnaires that were there for a convention. They all got sick. Turned out the virus was up in the air systems. Air quality, man. That's another cool job to have, air quality engineers. Well, if you have inflammation in your lungs all the time, you're gonna have, in a sense, if you're an asthmatic person where you've been exposed to, workplace, particulates that don't get out, like fiberglass or asbestos or maybe you just decided to smoke for the rest of your life, you're going to end up with something called chronic obstructive pulmonary disease. What happens in chronic obstructive pulmonary disease is that your body's in a chronic state of inflammation, and over time, that does its damage. All right, so alveolar surface areas, or the alveoli die, and over time, and this is the weird thing about COPD, you know, you're okay, you're okay, you're okay. Then you have a hard time breathing, and you can suffer through that for years and years and years, and be treated. There's all kinds of treatments for COPD. You might see it on the news, but eventually, just suddenly overnight, you hit the wall, and that's it, and it's time for a lung transplant. And you don't want to be there, so please don't smoke and avoid things like asbestos and organic solvents. Of course, a chronic or an acute thing that might happen is this atelectasis, or the collapsed lung. All right, and so atelectasis, collapsed lung, is an acute thing that's happening right now, and you got to have some sort of treatment. People that have this, COVID, when they get put on ventilators, have gone to atelectasis. All right, so it can occur acutely because of a respiratory infection, or other things. If you get shot in the chest, you could have a collapsed lung. There's a couple different ways that can happen. A pneumothorax or a pleural effusion. Pneumo, of course, refers to air. So if you got shot in the lungs, you'd have a hole in your the pleural sac. That's the bag that surrounds the lungs. Every time you breathe in, air goes into the lungs, but guess what? Air could go into that bag, escape the lung, go into the bag, and then eventually the accumulation of gases in that visceral pleura would force the collapse of the lungs. Right? So how do you fix that? Well, you cut a big hole inside of somebody's chest and jam a tube in there, a chest tube, and then you let some of that gas out. Sort of the same thing can happen with fluids. So you can have a hemothorax, right, where blood accumulates. And of course, if you have some sort of terrible disease like lung cancer, you can have a hydrothorax, which is this accumulation of pus in the lungs. You do the same thing you do with chest tube. This is what respiratory therapists do in the hospital, chest tube, and you pull that fluid out of there to keep the lung from collapsing. Which brings us to lung cancer. So lung cancer is responsible for, I think, 25% of all cancer deaths in the United States. You can avoid lung cancer largely by testing and by avoiding things like smoking cigarettes. And, I've got to tell you, over the course of the last decade or so, watching you guys as young people stop smoking was just so heartening to me. And then to see, see companies start to promote vaping is just heartbreaking. So please don't smoke. Cigarette smoke is terribly dangerous for you. And you can see this patient here. He probably regrets his smoking disorder. You see down here in his region here, he's got an infection back here in his right lung. Right, and that's cancer. This is a medical image, probably using nuclear medicine, where you put dye in there that accumulates in tumors. All right, so you got lung cancer, and this person didn't go to see the doctor very often because lung cancer is now metastasized. In fact, lung cancer is one of those cancers that metastasize readily, and sort of everywhere you see this little black dots, this person has tumors. Please don't smoke. Well, last but not least is the pulmonary embolism. An embolism is a clot, and most often these clots occur in the legs, and they can happen in other places. If you break a bone, you can have a clot that occurs, or even if you're having a baby, you can have a throw clot. So you throw clots, they get in the veins, and they end up in the lungs, and then they start this terrible positive feedback loop where they block the flow of blood, which kills that lung tissue, and then that diminishes your ability to exchange gases, which is all bad. So you have to take good care of yourselves. And if you're a nurse or doc, you're constantly making sure your patients move around to avoid clotting. Well, that's it finally. And here's some of my favorites, the Three Stooges. It's Curly, Moe, and Larry from left to right. Curly died in 48. Moe died in 75 from lung cancer. But Mo, Pro was really a funny one. And but Mo said about his brother, if we were going through a scene and he forget his words from it, rather than stand there and look goofy, he would fall on the ground and start spinning around. And I know right now seems to be frustrating and confusing, but maybe that's what you guys should be doing. Certainly funny. See you.